When you have chronic venous insufficiency, there's a myriad of things that can occur. Typically, the first thing most patients notice is a lot of varicose veins starting to come out on their legs. They might notice it around their ankles, usually on the inner part of their leg. But sometimes, other things that you might notice is that from time to time, you'll start noticing that you get swelling. Usually it's around your ankles and feet. It doesn't happen initially all the time, but you might notice it first during a flight or a long drive. But then after some time, you might start noticing that when you wake up in the morning, your legs are very small and thin, but by the end of the day, they're a lot more swollen. The other thing that'll start happening is you might start noticing that your legs start feeling very heavy and tired and achy, especially towards the end of the day. Sometimes you wonder, is this normal? Is it related to my work? Or is it my age? But typically, if it's related to veins, it's exaggerating. It's more than it should be. Other things you might start noticing is weird sensations on your skin, like tingling or itching or burning. Some patients even describe pain on the bottom of their feet or around a vein where it throbs. Some patients can actually have cramping, typically at night, or they might have restlessness where when they're laying down at night, they can't seem to sleep because they're constantly trying to move their legs in a comfortable position and they can't find that. So these are typical symptoms most patients have. Doesn't mean everybody has all of them, but usually it's some of these components. Ultimately, you might even start seeing changes on your skin, such as reddening or browning, or your legs start turning kind of a purplish color, especially towards the end of the day. And that's when you can start having even worse symptoms and even cause ulcerations.